Welcome to the Medico Bus. Today we will discuss section number 2, bacteria. If you have not watched the video of the section 1 of our bacteria, where we have discussed previously about mycobacteria and their species, so go back and watch and continue to learn the bacteria with us. In this section 2 of bacteria, today we will discuss spirochetes and the 3 species of spirochetes. We will discuss spirochetes. These are the thin-walled microorganisms. The morphology is they are flexible spiral rods. The locomotion in this spirochetes bacteria is achieved by the means of axial filament, which is present underneath the cell wall or inside the bacteria, which helps in locomotion. Like this, they move like this spirally inside the host. So, the twisted motion of this spirochetes bacteria increase its pathogenicity. Treponemas and Leptospira and Borrelia are the typical examples of this spirochetes family. Treponemas and Leptospiras are thin and they are detected by dark field microscopy, while Borrelia can be detected on standard light microscope and are thick. Now we will discuss about Borrelia burgdorferi. We will discuss Borrelia burgdorferi, which is an spirochete and is spiral in shape. And it can cause Lyme disease, which is most common in northeast of United States. This bacteria stain on the Giemsa stain, and the vector of the disease is mode of transmission is through arthropods, which are mostly ticks. As we say that it can cause Lyme disease is a vector-borne disease. It is a progressive disease which have a complex set of symptoms we will discuss later in this video, and it have 3 stages. We will discuss one by one. Stage 1 of Lyme disease. This is the early localized stage of Lyme disease. The symptoms starts appearing very slowly. The first symptom we can see in stage 1 is bull's eye rash, which is also known as erythema migrans. This is the appearing of a large bull eye rash like on skin. So these rashes are painless and non-puritic. These rashes can start appearing from 3 to 30 days after the tick bite. And the flu-like symptoms can also seen in stage 1. The flu-like symptoms includes fever, chills, headache, fatigue, and myalgias. The stage 2 of Lyme disease. This is also known as early disseminated stage. It occurs weeks to months later. In this stage, there is cardiac and neurological involvement. So the diseases associated with these stages are the facial nerve palsy, included Bell's palsy, and acute meningitis can also occur. And heart problems can also take place, such as myocarditis, the inflammation of the myocardium, atrioventricular block, abnormalities to the sinus rhythm of the heart. The stage 3 of Lyme disease, the late disseminated stage. The two important malfunctions, migratory arthritis, the joint pain which moves from one joint to another joint, encephalitis can also seen in the stage 3. The diagnosis and the treatment. The diagnosis can achieved by the IgM antibody in the blood, and the treatment can be achieved by giving tetracycline, doxycycline, and amoxicillin. Doxycycline should be avoided in children and pregnant women because it's contraindicated and have teratogenic effects for the children and pregnant women. And amoxicillin is safe to use. And at the late stage, we can use Ceftrixone, the third generation cephalosporin.